In this video, we're going to talk about transverse abdominis activation. The transverse abdominis wraps from the linea alba in the center of your body around your abdomen and inserts into the fascia that connects to your spine. As you inhale, your TA relaxes, and that's what causes your belly to expand. And then as you exhale, that's when the TA contracts around your body like a corset, helping to stabilize that intra-abdominal pressure. So again, inhale, relax, exhale, contract. Now let's compare that TA contraction to a rectus abdominis contraction, so the six-pack abs in the front of your body. The rectus abdominis, when it contracts, it's going to flex your body forward. It's going to round your back. It's going to create pressure in your abdomen. You can possibly feel that in your pelvic floor. And the transverse abdominis stabilizes your trunk. So here from the side, you can see the TA contraction, how everything stabilizes and comes together. And then the rectus abdominis contraction, my trunk flexes forward and my lower abdomen actually pokes out a little bit. So a TA contraction should not have any movement. The first thing you may have to do is actually learn to let go of your abdominals. So if you hold tension in your abdominals as you inhale, then you might not feel that expansion that you're seeing when I'm doing that here. When you inhale right here, you should see that expansion. Your abdominal should relax to allow that expansion. So that might be your first step, is just letting go of your abdominals so you get that expansion in the first place. A lot of people can't do that. And here's an example of a TA contraction versus sucking it in. So a lot of people get these mixed up. So this TA contraction in slow motion, you can see that my rib cage is coming down as I'm exhaling. My rib cage expands when I inhale, and then when my TA contracts, my rib cage is coming down. But when I do a sucking it in motion, my rib cage stays up. Can you see that almost negative pressure? So now let's look at some TA exercises that you can do. For these different exercises, you'll need a yoga mat or just a firm surface, a long foam roller, and a large pregnancy ball. In this position, my knees are bent so that my hip flexors aren't on stretch. I have one hand behind my back. That is to feel the just slight contraction around my spine that should happen when my TA contracts. The other hand is on my belly so I can get some feedback on that rise and fall. This is a good position to start with. Now here is a rectus abdominis contraction. If you do this and you feel your back push down into your hand behind your back, and it feels like you're about to start a sit-up, then you know that's not the right contraction. Now if that's pretty easy for you, you can move on to TA marching. So I'm still doing the exact same breathing, but with this activity, I am lifting a leg while I exhale. It's really important. That leg lift is with the exhale and TA contraction. This is to mimic more of what we do in everyday life. It's a little more functional because remember that TA should turn on when we move a limb, so we're training it to do that. Another variation is you can put your hands on your hip bones and feel for any sort of tilting that happens when you lift your foot. So here, you can see it in slow motion. When I lift my right leg, you don't see any tilting. My hands stay really even. That's what should happen. Now when I lift my left, can you see a slight tilt? That is because I'm a little asymmetric. A lot of people might be. So if you need to go a little bit higher level, you can go to the leg straightening. So this isn't a leg lowering. My legs aren't up in the air coming down. That's too much. But you can do the same activity with the breathing with the leg straightening. If you can do the previous marching exercise with proper form, meaning you can exhale through the whole thing, your back is staying stable, it's just gently, in contact with the ground, and your TA is contracting properly with not too much shifting, you can move on to this exercise. Remember to exhale through the entire motion, and your movement is always on the exhale. Okay, so this is one of my favorite ones. We're going to use the foam roller for this. So make sure when you lay on the foam roller that your entire spine from your sacrum up to your head is on it. Because if your head is dangling and you're having to hold your head up, your rectus abdominis will activate. So make sure that you're laying completely on it so that you're totally relaxed. Hands on your hip bone so you can feel for that shifting. And then when you're first starting, you can put your elbows down on the ground to help with your balance, but ideally this is done without your elbows on the ground. And now try that march. So you can see now that my TA contraction is a little more exaggerated because there's more force. There's more that needs to be stabilized against in this, because if my TA wasn't stabilizing, you can see again when I lift my left leg, I have a lot more wiggle. When I lift my right leg, I'm pretty stable, but when I lift my left leg, I have a little bit more wiggle. It's normal to have one side harder than the other just because we usually have a dominance, side dominance. Again, if you can do that with your elbows up with pretty good stability, exhaling through the whole motion, and no motion happening at your spine. I'm checking my spine to make sure that I'm neither popping up off the foam roller, nor am I pushing and squeezing my hand between my back and that foam roller, but I'm stabilizing my trunk. Then I know I can do that exercise. To make it even more functional, you can do this marching on a ball. Make sure that your hips are at the height or even higher than your knees. If your hips are lower than your knees, you can't get really into the right position to do this. And again, exact same thing. Now you're going to exhale and march one foot up. And the goal is to stay as stable as possible without too much side to side shifting.